In its simplest form, what our peer-to-peer connectivity hub really is, it's a means of driving economies of scale of establishing one-to-many connections across our health plan customers. So without the peer-to-peer connectivity hub, a health plan will need to establish point-to-point connections with health plans. And if you think about the, hundreds of health plans across the country, there's really no economies of scale. Like you think about that, you connect into one health plan, you really only connect into one health plan because every health plan is implementing their peer-to-peer API in slightly different ways. So Availity is really trying to leverage the fortunate position we have in the market today, sitting across a broad network of both health plans as well as providers of really being that connective tissue of being able to facilitate connectivity more seamlessly and easily for our health plan customers. In our peer-to-peer connectivity hub, it has three primary steps. The first one is that the member opts in for their new health plan to request their data from their previous plan. And so three scenarios can unfold when they do that. The member can provide their former member ID number and the name of their previous insurance carrier to their new health plan. Or the member doesn't know their former member ID number, but they do know the name of their health plan and their prior insurance carrier, and they can provide that to the new plan. And in that situation, the new plan then can facilitate that PDEX member match operation with Availity. And then the third option is the new member doesn't know their former member ID number or the name of their previous insurance carrier. And the new health plan can facilitate a member match across payers to try and locate that available data. So that's the first step in our peer-to-peer connectivity hub. Once member matching has been completed, a peer-to-peer API call is made to the connectivity hub, and we facilitate and enable confirmation of the member's information with the old plan. So we play the important role of one, ensuring that the requester of information is a valid plan and that they have member information that matches. So we provide security clearance and obtain that through a token request, ensuring that authorization access is provided to the member's data. And then the third step is the new plan requests and receives the member's information from the old plan, with all that data seamlessly being managed through the connectivity hub. And everything that I just laid out there, it may sound simple, but without that proper framework for facilitating the exchange of data, payers might struggle to respond to information requests or process that data from other payers. And, that can introduce privacy concerns and risks, and certainly lead to delays in treatment reviews, approvals, or other critical decisions relying on this data.